Hello everyone, I'm Lynn Karen, Communications and Digital Specialist at McFarland Clinic, and today I'm joined by Dr. Jill Alexander and Dr. Corinne Patton, two of our pediatricians here at McFarland Clinic. We have some frequently asked questions that parents are asking about the coronavirus. What is the novel coronavirus?
So human coronaviruses are a general family of viruses that have been circulating for a long time. We usually get them as the common cold. The coronavirus 19 that we're talking about was discovered in December of 2019, and it's a new virus that is circulating around the world, and we're still learning about it.
How can people protect their children from coronavirus?
Best ways to protect yourself is the things that we always do to keep us healthy. So we want to wash our hands for at least 20 seconds with soap and water. If you don't have soap and water, then you can use hand sanitizer with at least 60% alcohol. We want to stay home when we're sick. It's also great to teach your children to cover their cough or their sneeze, so you can use a tissue, and if you use that, you want to throw it away right away. If you don't have a tissue available, you can teach your children to cough into their sleeve. Other things to keep us healthy, you want to eat well and get good sleep.
I learned a tip from my son's first grade teacher. If you're going to wash your hands for 20 seconds, that's how long it takes to sing Happy Birthday twice. So wash your hands while you sing Happy Birthday twice.
It's also important to practice social distancing, which our community is doing a great job of, and that's just trying to stay away from other people so that we don't pass the virus back and forth.
Social distancing, actually, you're supposed to be 6 feet apart. And so clearly that would mean not gathering with other children for play dates or having lots of kids playing together on one set of playground equipment.
It's also important that you're not in big gatherings, so we want to keep those gatherings really small. We also suggest it's probably not a good time for kids to be around their grandparents who are in a higher risk age group. Fortunately, there are things like FaceTime now that we can use to keep in touch with those we love.
Should parents wear a mask around their children?
In general, when you're at home with your family, you're all breathing the same air and sharing the same germs. So you don't need to wear a mask in your home unless you're sick. If you're sick and having to take care of another person, you could wear a mask at that time.
The CDC did just change their recommendations, and they are recommending that people who are older than age 2 wear a cloth mask if they are going to the grocery store or to the pharmacy, and that is an updated recommendation. Kids less than 2, we probably shouldn't put a mask on because if they're having difficulty breathing, they don't always have the ability to reach up and move the mask, so it's not as safe.
Wearing a mask is helpful because it filters the air some and also keeps your fingers off your face. Your fingers are the easiest place to pick up droplets that have landed on surfaces, and then you transfer those to your face if you're touching your face, and a mask is an easy way to remember not to touch your face.
And we have been talking to kids for years. Every influenza season, when that's going around, we talk to kids about the importance of not touching their faces at all. So that's, while really important with this virus, that's important for all viruses. So it's a great habit to start already when you see your kids touching their face, and we remind each other. I remind my husband and my kids to not touch their faces as well. One reason not to touch your face is because you can get the virus in through your mucous membranes, which is if you rub your eyes or touch your nose or your mouth.
Are COVID-19 symptoms different in children than for adults?
COVID-19 symptoms in children are similar to adults, and most often we see things like fever, runny nose, and cough. The good news for the pediatric population is they tend to have a more mild illness with COVID-19, and so that's not always the case. Some viruses for kids are worse than adults, but what we have learned so far about COVID-19 is that children seem to be doing well when they get the virus. So while most kids do well with COVID-19, it's possible for a person of any age to have a more severe course. So just like with any virus, if your child is having difficulty breathing or is irritable or lethargic, which is too sleepy and difficult to get them to interact with you, those are still reasons to go to the emergency room and be evaluated.
Should I cancel my child's well visit?
Every week, sometimes every day, we are evaluating what is a safe plan for our patients. So we have made a lot of changes to make our facility a safe place for you to come when you need to come. And you can follow our lead on if you should come for a well visit or not. Currently, we are seeing 4 years old and younger for their routine well exams. And this allows us to keep a close eye on their growth and development during this time and keep them current with their immunizations.
We are separating our kids who have cough and cold and fever from other kids, so we're trying to keep those spaces different because it's still important. All the other healthcare problems that we have when coronavirus isn't going around are still present, and it's important that we don't miss some of those things during this time as well. Another option that we're working on is we're working on having telemedicine visits that are available to take care of your kids. There are some things that we can do well via telemedicine, and there are some things that we can't. It's important for us that we take good care of your children, not only convenient care, but also good care. So we are happy to talk with you on the phone and see if it's something that we can address in a telemedicine visit, or if it's something that we really need to see your child for.
If your child has fever, cough, runny nose, or other symptoms, we would like to see your child. And so we've created separate locations for your kids to come and see us. Sometimes parents feel strongly that they know what their child has. They have an ear infection or they have strep throat, and they would like us to treat those patients over the phone. And we still feel that that is not the best way to take the best care of your child. So instead, we've created a safe place for you to bring sick children and come and see us there.
If your child is treated with antibiotics when they don't need them, that increases resistance. And if we have increased resistance, then antibiotics won't work when we need them. So I would never treat my own child or Dr. Patton's child without looking in their ear. And I think we all feel strongly that we wouldn't treat your children differently than we would treat our own.
So there's a lot of news right now, and from a lot of different sources. And even as adults, it's really hard to filter in what is being said to us and what is credible. So how do we explain that to children and knowing what to give them that is credible?
It's important to try to filter the news a bit. When I listen to the news, it can be overwhelming at times. So we would suggest that you stay up on the current information from a reliable source, and then try to filter that information to your child in a way that they can understand. It's important to focus on things that they can do to stay healthy. So focus on washing hands, keeping away from people who are sick, the importance of why you're staying home and to not keep begging for those play dates, and things that they can do to help keep themselves healthy.
Children do well if they understand what they are doing to help. So if they understand that when they wash their hands and when they cover their cough, and when they stay home with their family, that they are being active in their role in keeping themselves and their community safe, that is a way that you can help them through this time.
It's also important to keep routine for kids. Routine is good for all of us, and when we feel out of control, routine does give us some sense of control. So trying to have set times, especially if they don't have school, times that you get up, times that you play, times that you work, times that you read, and trying to do those activities together as a family. If you feel like your child is becoming a lot more anxious and you have concerns, please call us, and we're happy to help you with that.
Thank you, Dr. Alexander and Dr. Patton, for joining us. For more information about coronavirus, including videos, resource links, and answers to frequently asked questions, please visit our coronavirus page at mcfarlandclinic.com/coronavirus.